So the voice and the ears. Yes. Well, if you get a frog in your throat sometimes and it kind of catches, and also if you get sounds in your ears once in a while, whether that's a high-pitched whistling or a whooshing sound or something like that, maybe even some itching or just you feel like you're poking around it a lot. Those two could have something in common. So the thing about the ears is you always want to get them checked. You want to get them checked. Make sure there's no infection, nothing there. Same with the throat. You always want to get your throat checked to make sure the organs in that area are fine and so on and so forth. But if everything comes back normal and you still have a problem, start to investigate a little further. And I'll tell you something that I notice, not all the time, but it's there and I notice it and it's not well understood. And that's spastic dysphonia. Spastic dysphonia. Dysphonia means unable to voice properly. Dysphonia. Spastic means that the reason for the voice going off is the muscles around the voice box, the larynx. There's actually muscles attached around that voice box and almost to it. It's very, very close by. And it goes up through into the jaw and into the neck. And those organs there and those structures in the throat sort of lie suspended there, attached almost with cables like muscles. They sort of suspend in the throat, which is kind of a neat thing, but also can be quite a bit of a pain sometimes. And it's going to feel like there's almost like a peach pit stuck in the throat. It's kind of slimy. There might be mucus buildup. Could be because of this, could be because of something else. We can always talk about it. But if it's the spastic dysphonia, that can be treated, and it takes very gentle treatments, very intuitive, very focused treatments for those tiny little muscles. You can't be too forceful with them. But what do they have in common with the ears? Well, when the ears start to feel kind of whooshy, like you're at the ocean, or kind of whistly, like there's a high-pitched noise, especially if you get those noises in certain body positions. In certain body positions, notice, really look at it. Does the noise happen when my head's in certain positions, or when I'm doing certain activities or things? There's also muscles back here around the ear that there's a little bone back there called the mastoid process. There's a lot of muscles around that mastoid process, and the ear canal itself, right up and in. There's a lot of muscles around those too. And then there's the jawbone. And those little tiny muscles can do a lot to the eardrums, which are the ear bones, the auditory bones back there. They operate on vibration, right? So we speak, we listen to music. Anything that has a sound has a vibration to it. It vibrates those little bones in the ear. Well, those tiny little muscles, if they're flexed, and they're like chronically flexed, pulling the mastoid process and the jawbone and the ear canal tightly together, those muscles are going to be vibrating on a very small, subtle level. And that vibration can affect our hearing, can affect those bones and cause the vibration in them. You start to hear noises. So that is the connection point sometimes, with the ears and the throat, is actually the muscles around it. It's the head position, the neck position, the throat position, the ear position, all positioning. So yes, go get everything checked. Make sure there's no latent infection. Make sure there's no stomach problem. Make sure all the other stuff has been ruled out. And if so, and you're still having a problem, let's explore spastic dysphonia and perhaps some muscle issues around the neck, throat, and face.